Fiscal policies targeting sugary beverages have proliferated globally, generating robust evidence on both economic behavior and health impacts. The accumulated data reveals that price increases do reduce consumption, though effects vary with design specifics and complementary policies. Meta-analyses synthesizing results across jurisdictions demonstrate consistent patterns. A 10% price increase typically reduces consumption by approximately 6 to 8%, indicating price elasticity that, while not extreme, translates to meaningful public health impacts at population scale. Larger taxes produce proportionally greater effects. Mexico's substantial tax generated more pronounced reductions than smaller levies implemented elsewhere. Purchase substitution patterns prove critical for evaluating net health benefits. When consumers replace sugary drinks with water or unsweetened beverages, health gains follow predictably. However, evidence shows some substitution toward other sweetened products, including fruit juices that, while marketed as healthier, often contain comparable sugar content. Optimal tax design considers these substitution risks, with some proposals suggesting comprehensive sugar taxes covering broader product categories. Socioeconomic distributional effects generate both celebration and concern. Lower-income households typically show greater price responsiveness, consuming less in response to taxes, exactly the populations facing highest diabetes and obesity burdens. However, as consumers of larger proportions of household budgets on beverages, they also bear larger relative tax burdens. This distributional tension prompts debates about tax fairness. Revenue reinvestment magnifies benefits substantially. When jurisdictions earmark soda tax revenue for health programs, community development, or subsidizing healthy foods, the intervention becomes doubly beneficial. Philadelphia's tax funding for pre-kindergarten education exemplifies this approach, building political support while addressing multiple social needs. Cost-effectiveness modeling projects substantial returns. Analyses incorporating reduced diabetes treatment costs, prevented cardiovascular disease, and productivity gains consistently show that soda taxes generate net economic benefits within 10 to 15 years, even before considering revenue uses. Some models suggest return on investment exceeding 10:1 for comprehensive tax schemes. Industry responses predictably include price absorption in some markets, reducing consumer-facing price increases and dampening behavioral effects. Additionally, companies reformulate products to evade taxes based on sugar thresholds, sometimes increasing sweetener complexity rather than reducing overall sweetness. These adaptations necessitate policy vigilance and periodic adjustment. Political challenges prove formidable. Industry-funded campaigns effectively frame taxes as regressive burdens and government overreach. Successful implementations typically require sustained advocacy coalition, including health organizations, community groups, and sympathetic legislators. Public health framing emphasizing child welfare and healthcare cost reduction generally polls better than fiscal revenue arguments. Long-term sustainability remains somewhat uncertain. Berkeley, California, the first U.S. city implementing a soda tax, shows sustained consumption reductions 5 years post-implementation, suggesting durable behavioral change rather than temporary responses. However, ongoing evaluation remains necessary as markets and consumer preferences evolve. International experience demonstrates implementation feasibility across diverse political systems and economic contexts. From high-income Norway to middle-income Mexico to lower-income South Africa, taxes reduce consumption when properly designed and enforced. The evidence increasingly supports soda taxes as effective policy tools within comprehensive strategies. While not silver bullets solving obesity or diabetes epidemics independently, they contribute meaningfully to population health when combined with education, environment modification, and healthcare access. The economic case, reduced healthcare expenditures exceeding tax revenue, strengthens political viability. For jurisdictions seeking evidence-based interventions addressing diet-related disease burdens, Well-designed beverage taxes represent proven approaches with global track records documenting both feasibility and effectiveness across diverse implementation contexts.